Good morning, everyone. So today my case is prolonged functional vision loss in a case of pediatric migraine. So headache is a common complaint among adults who present in ophthalmology OPDs, while children can also sometimes present with a complaint of a headache. If headache is associated with vision loss, it may signify an underlying grave pathology that needs an immediate and thorough evaluation. History and chief complaints of our case. We have a 7-year-old male child who complained of a right eye blurriness of vision for the past 1.5 months. He said the vision loss was painless, progressive, and aggravated in the last 2 to 3 days prior to presentation in the OPD. It was associated with a complaint of intermittent headache for the past 5 months, and his mother complained that there was an increased irritability to light and sound for the preceding 5 months. There was no previous history of any seizures, weakness, major illnesses, or trauma. On clinical examination, his BCVA with cycloplegic refraction was plano 624 N18 in the right eye, while plano 66 in the N6 in the left eye. Color vision, he was not able to read any of the plates in the Ishihara chart in the right eye, while left eye he read all the plates. EOM was full, free, and paleness. Pupils were round, reacting to light. There was a stress RAPD in the right eye. The anterior segments in both the eyes were normal. Optic disc was show the VCDR of 0.3 and healthy neuroretinal rims in both the eyes. Periphery and fovea in both eyes were within normal limits. So we attempted a visual field in this child. Though both eyes visual field had a low test reliability, the right eye had a concentric visual field defect, while OS has a superior arcuate kind of defect. We did a OCT RNFL, while the right eye had a temporo-inferior thinning, left eye had early temporal pallor. On the basis of the headache and the vision loss, he was advised an MRI brain and orbit, which was found to be within normal limits, but the child complained of worsening of headache and the vision dropped to finger counting close to face. So the child was immediately referred to a pediatric neurologist who underwent further evaluation after hospital admission. They repeated the MRI with a contrast enhancement and found few tiny non-specific cerebral white matter hyperintensities, and the rest was within normal limits. They had an MRV done, which was noted to be within normal limits. Both eye VP was done, which was within normal limits again. The blood for CBC, serum vitamin B12, and homocysteine came out to be normal. The child underwent psychiatric consultation there and revealed behavioral abnormality, which significantly improved with the counseling. The diagnosis made was a pediatric migraine with functional overlay, and he was treated only with NSAIDs and vitamin supplements apart from the psychiatric consultations, and was discharged from hospital after 36 hours with no headaches and a full visual recovery of the right eye vision. He was discharged with anti-migraine prophylaxis and lifestyle modification advice on discharge, and when he presented back in our OPD, the VCVA was noted to be 66 N6. The color vision was normal in both the eyes. There was no RAPD, and both anterior and posterior segments was within normal limits. So, as per literature, visual disturbances in migraine can have varied presentations, including monocular vision loss, which is mostly transient but however can be prolonged. Affective disorders are often, like depression or anxiety, are often coexistent in migraine patients and need concurrent evaluation and treatment. MRI brain findings in migraine have shown non-specific deep white matter changes and pupillary findings, which has been noted during the migraine attacks. Conclusion: while migraine can be a common cause of headache, other organic causes of headache and vision loss needs to be ruled out prior to making a final diagnosis of migraine. Functional vision loss should be kept in mind while dealing with migraine patients, as they might have concurrent affective disorders. These have been my references. Thank you.
On what criteria? This is key point to diagnose, ultimately label as a migraine.
So first of all, he was complaining of a headache, and it was a bilateral headache as per him, because he was showing like both my sides are paining, which is often seen in pediatric migraine cases. And there was a vision loss. Though he was saying there is a bloodiness of vision, we know that sometimes migraine with aura can have a vision loss present. So, and on the basis of pupillary findings, there have been reports that there can be stress RAPDs, or there can be benign episodic mydriasis of the pupils. So those were those criteria.
Okay. So, and just one technical point, in one of your slide you mentioned MRI plane. P means plane.
Yes.
In which condition? In pediatrics generally we offer, if you want to undergo that MRI, it should be MRI with contrast. The reason is most of the time under sedation or short GA. In which condition you can directly advise only few conditions you can advise MRI plain. What are the criteria to say MRI plain?
If there is some concurrent kidney disorders or
In your case, is
not
there anything?
my case,
No. Madam, your opinion regarding.
So, just see, when you put these sort of cases, now it will be good to have the fundus image.
yeah, sir, because at that point of time, our
Yeah.
hospital didn't have a very good fundus camera.
The second thing is, what is the cause of the RAPD? I'm wondering, since you said RAPD. I mean,
So,
ever since you said RAPD,
I
what
have
would be the
actually I am also not very sure, but I have read that in case of retinal migraine attacks, when there might be decreased blood supply to the optic nerve or the retina, there can be a trace RAPD.
because there is vision loss, there is RAPD, there is a color vision loss.
Yes. So
And then you are calling him functional.
yes, that's why he was advised an MRI urgently, and the MRI also repeated to find out if there was actually any organic lesion. But they didn't find any. The only thing they found was the deep white matter lesions that is often seen in migraine patients.
I think fundus examination at the time of decreased vision is very important, because if you are suspecting retinal migraine, there would be narrowing of the retinal blood vessels. So that's
You
important.
heard of this entity called benign episodic?
Episodic unilateral mydriasis.
Yeah.
So you want.
I don't know if it's that, but
It
in that
might
you
have been
don't get
that.
color
I also
vision.
thought in on the hindsight, I also thought that it might have been BUM, which I had because the child was not cooperating well. So it might have been that. I would have thought it's an RAPD, grade 1 RAPD.
Okay.
Can I take one question? You have used a very generic term, migraine. In migraine, if you divide broadly also, there are 4 types. It may be tension headache, maybe cluster headache. And by definition, migraine is usually unilateral.
Yes.
And there's something.
Outside, you can ask, but we will not include in our survey. Okay. Now your is over.
Yeah.
Marking is over. Now we can.
This was contributing for the
Yes, yes,
subject.
please, please.
Yeah, science.
Please, please. Now we can. Now you're free. You're all done. So then you can. No, you can answer. You can if you want.
So, by definition or otherwise, it is not going to be. Sometimes what happens, if doctor is so much into literature and read so much, so sometimes it goes to the patients. हम ज़्यादा पढ़ लेते हैं कई बार वो भी एक syndrome होता है. So there are some simple things are there. So maybe functional for some child are there, but in functional we can also rule out those things.